Care Quality Commission finds rise in detentions due partly to strain on healthcare system. The number of patients sectioned has risen by 40% between 2005-06 and 2015-16 from 45,484 to 63,622. Photograph, Peter Byrne, PAA. Lack of mental health services in England means a growing number of patients are having to be sectioned to get help, according to the NHS care regulator. A review by the Care Quality Commission found that the rise in the number of detentions under the Mental Health Act was due partly to the fact that the healthcare system was under considerable strain. The number of patients sectioned has increased by 40% between 2005-06 and 2015-16 from 45,484 to 63,622. The CQC noted that unavailability of community care support was leading to high numbers of detentions, and demand for beds also meant patients tended not to be admitted on a voluntary basis. Dr. Paul Elliott, the lead for mental health at the Care Quality Commission, said, "Some of the factors at play in the rising rates of detention, both nationally and locally, are also signs of a healthcare system under considerable strain. Detentions under the Act can be influenced by gaps in support and provision in the system." He added, "This includes limited hospital bed availability, which means that people cannot easily be admitted as voluntary patients early in the course of their illness." The CQC also noted other issues that had led to the rise in the number of detentions, including population growth, better national reporting and increased awareness of mental health problems. Professor Wendy Byrne, president of the Royal College of Psychiatrists, said, "The CQC report is further evidence that declining access to community services is leading to more people reaching mental health crises and highlights the limitations of relying on legislative change to reduce rates of detention under the Mental Health Act." Vicky Nash, the head of policy and campaigns at the mental health charity Mind, said, "Ultimately this report confirms what we hear every day about the state of NHS mental health services. Many people are not getting the right care when they ask for help and, as a result, are more likely to become more unwell, reach crisis point and need to be detained under the Act. People are detained under the Mental Health Act to make sure they get treatment, care and support from hospitals. Although this is in the person's best interests, it is often against their wishes and the law is supposed to be used only when other options have been considered." Barbara Keeley, the Shadow Minister for Mental Health, said, "It's time the Tories faced up to the damage they have done to mental health services and immediately invest in and ring-fence mental health budgets, as Labour has pledged." An NHS England spokesperson said, "There is no one-size-fits-all answer as to why the number of detentions appear to be rising, although the recent shift to use of the Mental Health Services dataset will help bring fresh insights. We will continue to work with partners like the CQC to examine and address some of the complex issues at play to ensure people get the best possible care, in the right place, at the right time. To this end we are investing in and improving the crisis care pathway to provide earlier intervention and alternatives to admissions as one important component of wider work to improve people's access to and experience of acute mental health care, including plans to eliminate out-of-area placements for adults in acute settings." A Department of Health and Social Care spokesperson said, "This report makes clear there are a range of factors which are leading to an increase in the numbers detained. We want to ensure the Act works better for patients and their families. That's why we commissioned an independent review, which is due to report in autumn. Of course, there is always more to do, which is why we are investing an additional £1 billion by 2020-21.